Lipo 360 is really the description of the areas that we're going to be doing the liposuction on. So we're using traditional liposuction with that. However, the Lipo 360 really talks about the areas that I'm doing, and that really encompasses the abdomen, what we call the flanks or the waistline, and then the back, lower back and upper back. So 360 as in 360 degrees all the way around. Traditional liposuction is the method of the liposuction. So that's using the cannulas or the sterile metal tubes that we use to get the fat out connected to the suction device. So we're using that traditional liposuction. Lipo 360 means the areas that we're doing the liposuction on. We take that fat that we've collected, so removed it from the spots that we don't want, and we then transfer it into the butt to really shape the butt. So it, again, removes the fat from the areas we don't want, puts it into the places that we do, and the overall picture is a nice curvy waist with a nice, beautiful round butt. A Lipo 360 is doing the liposuction, so that's with small incisions, and the cannula or the little metal tube goes in and I remove the fat, and that's just taking the fat. The tummy tuck is an incision that removes the skin. So when you have the loose skin, it allows me to remove that, as opposed to the liposuction is just removing the fat. To a certain extent, when you do the Lipo 360 and you wear the compression garments afterwards, you will get some skin tightening, but it depends on the patient's initial anatomy and their skin quality. But really, when someone has a fair amount of loose skin, cutting it and removing it and pulling everything tight is a better method. Lipo 360 can be combined with other procedures, and we do it quite a bit. You can combine it with the fat transfer to the butt. We can combine the Lipo 360 along with a tummy tuck, so we get rid of the fat and we get rid of the skin. We can combine the Lipo 360 with breast procedures. We can do a breast augmentation, so you can get rid of the fat around the waist and then enhance the breasts, and multiple other combinations. Mainly the trunk, so the abdomen, the waistline, and the back. That really is what describes the 360. You can also add to that. You can do a Lipo 360 and do the arms. You can do a Lipo 360 and do the thighs. So there's little additions that you can make, but the Lipo 360 really encompasses the main trunk of the body. The ideal candidate for Lipo 360 is a healthy patient, preferably someone that is not a smoker or who has never smoked, someone who has good quality skin, meaning that it still has some elasticity to it, and not too much jiggle to it or kind of lag to the skin. You want it to be able to snap back into place once I do the liposuction. By taking care of themselves, eating healthy, high protein diet is very good. I don't want to see a big weight gain going into surgery. I want someone to maintain their weight or even sometimes lose a little weight prior to the surgery, and just treating themselves healthy. The type of anesthesia used for this, for the best result, is doing general anesthesia. That's putting the patient to sleep. What that does is that allows them to sleep comfortably with good pain control, and that allows me to really perform at the highest level so I can remove as much fat as possible. So the recovery time for a Lipo 360 procedure is about 1 to 2 weeks. Patients differ. Some patients can recover quicker, some longer, but on average, 1 to 2 weeks is the time to get back to their job, especially a desk job. A majority of that swelling's down, and you really see a good result there. And then with every passing month after that, you'll see better and better and better and better.